Today we're diving into a topic that touches millions worldwide. Skin cancer. Whether you're here to learn, protect yourself, or support a loved one. This journey through understanding skin cancer will empower you with life-saving knowledge. Let's begin. What is skin cancer? Skin cancer, simply put, is the uncontrolled growth of abnormal skin cells. When skin cells get damaged, usually due to excessive exposure to ultraviolet radiation from sunshine or tanning beds, they can multiply rapidly and form malignant tumors. But let's break this down further. These dangerous cell growths can invade and destroy healthy body tissue. And this, my friends, is what we know as skin cancer. Interestingly, it's now the most commonly diagnosed form of cancer in humans. So understanding its warning signs and prevention methods is vital for all of us. The primary culprit, UV radiation. You see, the main villain behind most skin cancers is prolonged exposure to ultraviolet UV radiation from the sun or tanning devices. This radiation causes damage to DNA and skin cells, leading to uncontrolled growth and the formation of tumors. Now, while the sun is essential for life, its rays can also be harmful. Different types of skin cancer occur due to varying genetic changes within the skin cells. We'll dive deeper into the three main types shortly. The three main types of skin cancer. Understanding the different types of skin cancer is essential for early detection and appropriate treatment. 1. Basal cell carcinoma. BCC, basal cell carcinoma, is the most common type of skin cancer. It frequently develops in people with fair skin, though people with darker skin can also develop this cancer. May present as small, pink or red, translucent, shiny, pearly bumps with blue, brown, or black areas. Can appear as flat, firm, pale, or yellow areas similar to a scar. BCCS grows slowly and rarely spread to distant areas or result in death, but they can damage surrounding tissue if left untreated. Early diagnosis and treatment are crucial as BCC can grow deep, potentially penetrating nerves and bones, causing damage and disfigurement. 2. Squamous cell carcinoma. SCC, squamous cell carcinoma, is the second most common type of skin cancer. While less common than basal cell cancers, they have a higher tendency to spread. Key characteristics: often appears as a red, firm bump, scaly patch, or a sore that heals and then may present as a hard lump with a scaly top or form an ulcer. Tends to form on skin that gets frequent sun exposure, such as the rim of the ear, face, neck, arms, chest, and back. More likely to spread than basal cell carcinoma. SCC can grow deep into the skin, causing damage and disfigurement, making early diagnosis and treatment essential to prevent spreading to other areas of the body. 3. Melanoma. Melanoma is often called the most serious skin cancer because it has a tendency to spread. While it's the least frequent of the three common skin cancers, it's the most aggressive. Key characteristics: can develop within an existing mole or appear suddenly as a dark spot. Commonly asymmetrical in shape and pigment distribution. Features irregular borders, color variation, and often greater than 6 millimeters diameter. Frequently metastasizes and can cause death once it spreads. Remember the ABCDE warning signs: asymmetry, border irregularities, color changes, diameter larger than 6 millimeters, evolving or changing characteristics. Warning signs and symptoms. Most skin cancers don't cause bothersome symptoms until they've grown quite large. However, knowing what to look for can help you spot signs when cancer is still small and easier to treat. Key warning signs include a new, expanding, or changing growth spot or bump on the skin, a sore that bleeds or doesn't heal after several weeks, a rough or scaly red patch which might crust or bleed, a wart-like growth, a mole that's new or changing in size, shape, or color. Symptoms that include new bumps or patches on your skin or changes in the size, shape, or color of skin growths. Additional symptoms to watch for: a sore or area of skin that doesn't heal within 4 weeks. Skin that looks unusual, hurts, is itchy, bleeds, crusts, or scabs for more than 4 weeks. The staggering statistics. Understanding the scope of skin cancer helps emphasize its importance. Global impact. An estimated 331,722 people were diagnosed with melanoma globally in 2022, with approximately 58,667 deaths from this disease. For non-melanoma skin cancer, an estimated 1,234,533 people were diagnosed globally, with approximately 69,416 deaths. Melanoma ranks as the 17th most common cancer, while non-melanoma skin cancer ranks as the 5th most common cancer worldwide. United States statistics. The rate of new melanoma cases is 21.9 per 100,000 men and women per year. The death rate is 2.0 per 100,000 men and women per year. Approximately 2.2% of men and women will be diagnosed with melanoma at some point during their lifetime. In 2022, there were an estimated 1,504,676 people living with melanoma in the United States. Prevention. Your first line of defense. The good news is that skin cancer is largely preventable. Here are the essential prevention strategies. Sun protection essentials. Seek shade when appropriate, especially between 10 a.m. and 4 p.m. when the sun's rays are strongest. If your shadow is shorter than you are, seek shade. Wear sun protective clothing, including lightweight, long-sleeved shirts and pants, wide-brimmed hats, sunglasses with UV protection, clothing with ultraviolet protection factor (EPF) labels for maximum effectiveness. Sunscreen guidelines. Apply broad-spectrum, water-resistant sunscreen with an SPF of 30 or higher. Broad-spectrum sunscreen protects from both UVA and UVB rays. Proper application tips. Use sunscreen whenever you're going outside, even on cloudy days. Most adults need about 1 ounce of sunscreen, roughly a shot glass amount, to fully cover exposed skin. Don't forget often missed areas: tops of feet, neck, ears, and top of head. Reapply every 2 hours or after swimming or sweating. Additional prevention strategies. Avoid tanning beds completely. Ultraviolet light from tanning beds can cause skin cancer and premature skin aging. Remember, a tan is a sign that your skin has been injured. Use extra caution near water, snow, and sand as they reflect the sun's damaging rays, increasing your chance of sunburn. Perform regular skin self-examinations to detect skin cancer early when it's most treatable. Treatment options. Hope through medical advances, the treatment landscape for skin cancer has evolved significantly, offering patients multiple effective options. Traditional surgery involves removing the cancer and some healthy tissue around it. Mohs surgery, a specialized technique that removes skin cancer layer by layer using a microscope to check for cancer cells after each layer removal. This continues until no cancer cells remain, allowing surgeons to remove cancer while preserving as much healthy skin as possible. Curettage and electrodesiccation removes the top of the skin cancer with a scraping tool, then uses an electric needle to sear the base of the cancer. Advanced treatment options. Radiation therapy treats cancer with powerful energy beams. Immunotherapy uses medicine that helps the body's immune system find and kill cancer cells. Targeted therapy uses medicines that attack specific chemicals in cancer cells, causing them to die. Photodynamic therapy, a two-stage treatment combining light energy with a medicine that kills cancer cells when activated by light, chemotherapy, and skin creams. Some medicines for skin cancer come as topical treatments applied directly to the affected area. The power of early detection. Most skin cancer is treatable if it's caught early. This makes regular self-examinations and professional skin checks invaluable. Self-examination guidelines. Monthly skin checks are recommended. Examine your skin head to toe every month, looking for any new, changing, or unusual spots. Professional dermatology visits. See a dermatologist at least once a year for a comprehensive professional skin examination. Photography tip. Take photos of suspicious areas with a ruler nearby to track size and changes over time. This can help you and your doctor monitor any developments. Living with hope. A message of encouragement. If you or someone you love is facing a skin cancer diagnosis, remember that knowledge is power and early action saves lives. The medical community has made tremendous advances in skin cancer treatment, and survival rates continue to improve. You are not your illness. You have an individual story to tell, and you have a name, a history, a personality. Staying yourself is part of the battle. Your diagnosis doesn't define your courage, strength, and determination do. There is hope. Even when your brain tells you there isn't, every day researchers are working on new treatments, and every day people are winning.